Something is happening inside your body right now, and your feet already know about it. Most people over 60 chalk it up to aging. Tired feet, dry skin, a little numbness. Normal, right? That's exactly what I used to hear from patients before complications showed up that could have been caught months earlier. Here's what surprises most people. Diabetes doesn't announce itself with one dramatic moment. It whispers first, slowly, quietly. And the earliest whispers almost always start below your ankles. One of my patients, a retired school bus driver from Ohio named Dominic, came in for a routine checkup. He had no idea the mild changes in his feet already pointed to something serious. What I'm about to share changed how Dominic saw his health. It may change how you see yours too. Before we start, make sure to hit like, share, and subscribe to this channel. And really, I'm curious, where are you watching from? Let us know in the comments. We love seeing how far our videos reach. Hi, I'm Dr. Alistair Vance. For the last 20 years, my career has been defined by one question. Why does the modern medical system wait for you to break before they try to fix you? As a researcher in nutritional biochemistry with 2 decades on the front lines of senior healthcare, I've overseen the recovery of thousands of patients, men and women aged 50 and above, who were told their decline was inevitable. My mission now is simple: to take the complex longevity science and turn it into simple common sense protocols you can use to reclaim your vitality today. Like I said, I've practiced internal medicine for over 20 years, working with seniors across Phoenix and Atlanta. And what I keep seeing, week after week, patient after patient, is that the body starts revealing blood sugar stress long before any lab result catches it. And that's exactly where we need to start, with why your feet carry this information at all. So let's get started. Think about how your body is built. Your heart sits at the center, your brain sits at the top, but your feet, they're at the very end of the line, the furthest point from your heart. The last stop for your blood, your oxygen, your nerve signals. And that distance, that long, quiet road from your core to your toes, is exactly why feet become the first place the body breaks down when blood sugar starts causing internal damage. Here's the simple biology most people never hear explained this way. When blood sugar stays elevated, it slowly damages 2 things: your nerves and your blood vessels. Not overnight. Not dramatically, just quietly, consistently, over months and years. Think of your nerves like the electrical wiring running through a large rural farmhouse, long lines stretching from the main panel all the way out to the farthest rooms. When something disrupts that system, the lights don't go out in the kitchen first. They flicker at the end of the house, the room farthest away. That's your feet. And here's what makes this especially important for those of us over 60. After 60, circulation naturally slows. The body's ability to heal small damage takes longer. Nerve sensitivity, the speed at which signals travel from your feet back to your brain, has already been quietly declining for years. So when blood sugar begins compounding on top of that, the warning signs appear faster, and they're easier to dismiss as just getting older. That's the trap. That's the dangerous middle ground where most complications begin. I've had patients, hard-working, health-conscious people, who spent months attributing early symptoms to their age. A little tingling after sitting down. Feet that felt oddly dry, no matter how much lotion they used. One foot that stayed cooler than the other. They weren't ignoring their health. They genuinely believed those things were normal. And in some cases, by the time a lab result finally flagged something, the nerve involvement was already significant. That's not their fault. Nobody told them what to look for. Have you ever noticed a strange feeling in your feet and just moved on with your day? If your answer is yes, you're not alone. I want to see how many of us have been there. Because what I'm about to walk you through aren't rare, complicated symptoms. These are subtle, everyday changes already showing up in millions of feet across the country. 7 signs, each one more telling than most people realize. But the first two, the nerve warning signals, are the ones that show up earliest. And the second one especially, it tends to hit hardest when everything else is quiet, like at night. If this is already hitting close to home, share this with someone who needs to hear it. This information could matter more than you know. At night, when the house is quiet and there's nothing left to distract you, that's when your body finally gets loud. But let's back up to where it starts, because the burning sensation most people notice at night isn't actually the first signal. Something comes before it. Tingling. Not dramatic, not painful. Just a mild, almost electrical buzz, usually starting in the toes, sometimes spreading toward the heel. Most people feel it and think they've been sitting wrong, or crossed their legs too long, or slept in an awkward position. I've heard every version of that. And I understand why people go there first. It's the most comfortable answer. But here's what's actually happening beneath the surface. When blood sugar stays elevated, glucose begins to irritate and slowly damage the nerve fibers running through your feet. Think of those nerves again, those long electrical cables. Now imagine the outer insulation starting to fray. The signal doesn't cut out completely. Not yet. It just starts to distort. It flickers. It misfires. That's the tingling you feel. It's not a circulation issue from sitting wrong. It's your nervous system sending a distorted signal. That's sign number one. And most people live with it for months before they mention it to anyone. Sign number two is harder to ignore, but it tends to arrive later. The burning sensation. Unlike tingling, this one doesn't feel minor. Patients describe it as a deep, uncomfortable heat moving through the feet and lower legs. And it almost always gets worse at night. During the day, your brain is processing movement, conversation, tasks. But the moment you lie down, the noise fades. Your nervous system's misfiring becomes the loudest thing in the room. There's nothing left to drown it out. The result? Disrupted sleep, night after night, and exhaustion that compounds everything else. According to the American Diabetes Association, peripheral neuropathy affects nearly half of all people living with diabetes. Half. So what can you actually do right now? First, build a simple daily walking routine. Even 30 minutes through a quiet neighborhood keeps circulation moving. Second, start reducing processed sugar from your daily meals. Not perfection, just reduction. It matters more than most people realize. But here's what I need you to understand. Nerve symptoms are only the first layer. What comes next doesn't affect how you feel. It affects how your body heals. Most people assume healing is automatic. You get a cut, your body fixes it. That's just how it works. Except when blood sugar has been quietly damaging your circulation. That assumption stops being true. And the moment you notice it, it's already been happening for a while. Here's a scenario I've seen more times than I can count. Someone buys a new pair of shoes, breaks them in over a weekend, gets a small blister on the back of their heel, the kind most of us have had 100 times. They put a bandage on it, go about their week, and expect it to be gone in a few days. 2 weeks later, it's still there. Not infected, just not healing, sitting open. And that's when they start to worry, because something that simple should not take that long. That's sign number 3. The medical explanation is important. When blood sugar remains elevated, it gradually narrows the small blood vessels that deliver oxygen and nutrients to your tissue. Less oxygen means the repair process slows. Think of your body's healing system like an irrigation network running through a large garden. When the pipes are clear, every section gets what it needs. But when sections of that system become restricted, certain areas stop getting water. The plants don't die immediately. They just struggle. They stop thriving. And eventually, they can't recover from even minor stress. Your skin, especially on your feet, works the same way. Now here's where sign number 4 enters. Discoloration, darkening patches, a reddish tone or a subtle bluish tint. Most attribute it to age or sun. It's not. It's not. That discoloration is your body showing you, visibly, on the surface, that blood flow to that area is compromised. It's an early vascular signal, and when paired with slow-healing wounds, it creates a dangerous combination: open skin that can't repair itself in an area without adequate circulation. The CDC has reported that diabetic foot complications are among the leading causes of lower limb procedures in adults over 60 in the United States. Not because the wounds were severe, but because they weren't caught and treated early enough. So starting tonight, before you go to bed, take 60 seconds. Remove your socks. Look at your feet in good lighting. Check for anything open, discolored, or different from last week. Clean any small wounds gently and cover them properly. That one habit changes outcomes. But the next two signs we're covering, they don't show up as wounds or discoloration. They show up in ways most people never think to connect to their blood sugar at all. And one of them, you've probably been blaming on the weather. Before we continue, you might never see another video from this channel because you forgot to subscribe. So please like, share, and subscribe to this channel. It is the only way you tell me that the hours researching and writing these videos is worth it. Now, let's continue. You blame the weather. Maybe the season. Maybe winter air in places like Michigan or Illinois just does that to your skin. And maybe, in someone else's situation, you'd be right. But when dry skin on your feet becomes a permanent condition rather than a seasonal one, something deeper may be driving it. Most people never make that connection. Now, sign number 5, chronic dryness, cracked heels, skin that feels rough, tight, and brittle. No matter what you put on it, it's not just the weather. But the origin of this dryness isn't coming from outside. It's coming from a breakdown in your autonomic system, the part that handles heart rate, digestion, and moisture production. When sugar damages these nerve fibers over time, the sweat glands in your feet stop receiving proper signals. They underperform. They stop functioning. The skin can no longer regulate moisture. Think of it like a wall that's lost its internal structure. You can repaint the surface, but if the foundation is compromised, the cracks keep coming back. That's your heels. This isn't just a comfort issue. Those cracks are open breaks. Every crack becomes a potential entry point for infection. Small, easy to miss, but dangerous when left unaddressed. So what do? First, water intake. Hydration affects skin from the inside. Second, moisturize your feet every night, focusing on the heels and the ball of the foot. But here's a detail most get wrong. Never apply moisture between your toes. That area needs to stay dry. Trapping moisture there creates its own set of problems. Small habits change the long-term picture. Now, we've talked about nerves, healing, and skin. But when circulation weakens further, the warning stops being something you feel on your skin. It becomes something you see, something that leaves a mark every single day. If you've ever taken off your socks and noticed something that made you pause, what I'm about to reveal next is going to hit differently. Have you ever taken off your socks at the end of the day and seen the ring they left behind, pressed deep into your skin, still visible 10 minutes later? Most notice it. Very few ask why. They assume it's the socks. Too tight, maybe, or they were on their feet too long. They switch brands, buy shoes with more room, and don't give it another thought. But that mark is not a clothing problem. It's your body telling you fluid is building up in places it shouldn't be. And it connects to something most people never expect: their kidneys. When blood sugar remains elevated, it places increasing strain on the kidneys, the organs responsible for filtering waste and regulating fluid balance throughout your body. When the kidneys struggle, they become less efficient at moving excess fluid. That fluid has to go somewhere, and because of gravity, it settles in your ankles, your feet, the lower legs. Think of your body's drainage like a filtration unit. When the filters get clogged and overwhelmed, the system backs up. Water pools where it shouldn't. Pressure builds. That's what's happening when you notice your shoes fitting tighter in the evening than in the morning. And here's what makes this sign particularly serious. According to the National Kidney Foundation, diabetic kidney disease affects approximately 1 in 3 adults living with diabetes. 1 in 3. Catch it before the lab result. What can you do? First, when you rest, elevate your feet above the level of your heart for 30 minutes. Second, take a close look at your sodium intake. Processed foods and packaged snacks fill most pantries. They carry far more sodium than most realize, and sodium directly drives fluid retention. Reducing it takes pressure off. These aren't complicated changes, but they send a very different signal to your body than doing nothing at all. Now, swelling tells us circulation is struggling, but the final sign tells us something even more concerning. It tells us how far that circulation loss has actually progressed. This last one may connect every dot. Tell me if this sounds familiar. You're sitting in a warm room. The heat is on. Everyone around you is comfortable, but your feet are cold, not a little cool. Cold. Cold in a way that extra socks don't fix. Cold in a way that's been going on long enough that you've just accepted it as normal. Maybe you've mentioned it and people shrugged. But I need you to stop accepting that as normal, because consistently cold feet, regardless of the temperature, is one of the clearest signals that blood flow has become significantly reduced. Over time, elevated blood sugar accelerates the narrowing and hardening of the arteries, including the smaller arteries carrying warm, oxygenated blood all the way down to your feet. When those pathways narrow enough, blood flow slows, and when blood flow slows to your extremities, warmth goes with it. Your feet become the last room in the house that the heating system can no longer reach. Think about an old house in winter. The furnace is running. The rooms near the center stay warm, but the far bedroom at the end of the hallway stays cold no matter what the thermostat says. That's not a thermostat problem. That's a delivery problem. And in your body, that delivery problem has a name. Peripheral artery disease, PAD, is directly linked to blood sugar elevation. According to the American Heart Association, people managing blood sugar challenges are significantly more likely to develop PAD, and many don't receive that information until symptoms are present for years. Cold feet in this context aren't a comfort issue. They're a circulation issue, and circulation issues left unaddressed have consequences that extend well beyond discomfort. So here's what you can do, starting tomorrow morning. First, a simple daily walk. It doesn't need to be long or intense. 20 to 30 minutes at a steady, comfortable pace. This keeps blood actively moving through those narrowing pathways and helps slow the progression. Second, before you get out of bed, spend 2 to 3 minutes doing gentle mobility exercises. Ankle circles, toe flexes, simple movements that wake up circulation before you put weight on your feet. Small, consistent, purposeful. Now, here's what I need you to understand. These 7 signs are not random. They are not coincidences. They are not simply the cost of getting older. They are connected. They follow a pattern. And that pattern, when you know how to read it, tells a story your body has been trying to share with you for a long time. The question is what you do with that story now. You now know what most people walk past every single day, not because they don't care, but because nobody told them what to look for. You have that now. And knowledge like this, acted on early, is what separates a manageable situation from a complicated one. And that is it for today. But before I go, let me share this disturbing fact. In my 2 decades in the senior healthcare sector, the saddest thing I've seen is a senior who gave up too soon because they didn't have the right information. You owe it to yourself, and more importantly, you owe it to the family who wants to see you at the graduation, the wedding, and the holiday table to stay informed. By subscribing, you're making a pact to stay sharp and present. If you aren't willing to invest 1 second to click that follow button, are you really invested in your future? Let's get to work. Hit subscribe, and I'll see you in the next video.